Well, June is Aphasia Awareness Month, and certainly awareness has been heightened by the recent news about Bruce Willis, who was diagnosed with aphasia. Aphasia is not a diagnosis. Aphasia is a symptom or a sign of a cause that is the ultimate diagnosis. Aphasia literally means lack of words, inability to either understand words or express them. Hence, two different types of aphasia, expressive versus receptive. Those two functions live in two separate portions of the brain, and damage to those portions can produce the condition we call aphasia. The diagnosis of that damage is the key issue. Some may remember a reporter on a TV broadcast, a news broadcast, suddenly developing garbled speech. And the camera blanking out. Folks assumed that she had had a stroke. It was a type of stroke, actually a complex migraine attack, which deprived her brain in the area where she expressed words of sufficient blood flow to fire those brain cells and make them enable her speech. Complex migraine can be a diagnosis that causes aphasia and is transient and goes away without any residual damage. More severe diagnoses that can cause aphasia include an actual stroke where blood supply is permanently deleted to a portion of the brain that either expresses words or is able to perceive them. Less sudden forms of aphasia, perhaps like the ones affecting Bruce Willis, can be due to a neurodegenerative disorder, something like Alzheimer's or other types of degenerative disorders that gunk up the brain in the areas where speech is formulated or understood. So those are examples of conditions, diagnoses that cause the symptom or sign of aphasia.